Hi, this is Lois Haggard. I manage the Community Health Assessment Program in the New Mexico Department of Health. This video series is called Community Health Assessment. The series will cover core concepts of community health assessment in public health. This first video provides a high-level overview. First, let's think about what we mean by health. Here are 4 different definitions. From Wikipedia, we have the level of functional and metabolic efficiency of a living organism. From Webster's Dictionary, the condition of being sound in body, mind, or spirit, especially freedom from physical disease or pain. From the World Health Organization, a dynamic state of complete physical, mental, spiritual, and social well-being, and not merely the absence of disease or infirmity. And I threw this one in from American Public Health Association Executive Director George Benjamin, who says, "Health is living as long as you can and as well as you can, and having a short but glorious ending." It also means having a system in place that ensures we can all achieve health. Many people I know in public health adopt the third definition from the World Health Organization. Well, we've thought about health. Now, what do we mean by public health? In 1988, the Institute of Medicine, which is now called the Health and Medicine Division of the National Academies of Sciences, defined public health as what we as a society do collectively to assure the conditions in which people can be healthy. They define community health assessment as one of 3 core functions of public health, along with policy development and assurance of access to health care and the quality of that care. The Centers for Disease Control and Prevention's 10 essential public health services also embody the 3 core functions. To help think about community health assessment, I'd like to use an analogy of a typical doctor visit. Doctors use what they call SOAP notes to document a patient's visit. SOAP is an acronym for Subjective, Objective, Assessment, and Plan. During a visit, a clinician assesses an individual's health. He or she bases her assessment on subjective information, such as the patient's report of pain, and objective information like body temperature and x-rays. Based on the information, the clinician makes an assessment or a diagnosis and designs a treatment plan, and may also schedule a follow-up visit to assess the patient's progress. In assessing the health of a community, we are like community doctors, where our patient is the community. Subjective information includes input such as direct contact from community members and qualitative surveys. Objective information includes statistics such as rates of death or illness and information from quantitative surveys. Assessment usually takes place with some sort of community input and involves using the information to identify priority health issues for health improvement. A plan, called a health improvement plan, identifies community interventions that are expected to be most effective on the basis of established evidence-based practices. For instance, increasing seatbelt use to reduce motor vehicle traffic crash injury and deaths. The community should also schedule up a follow-up visit to reassess how the plan is working. Another way to look at it is as a cyclical process, starting with assessing the health status of the population, developing a health plan such as a SHIP or a CHIP, implementing the plan, and then reassessing, revising the plan, and so forth. Accurate health assessment information is a critical component of planning and decision-making for health improvement in public health. Doing good health assessment not only provides input to health improvement plans, but can also improve health equity and allow public and other agencies to make the best use of our scarce resources. In summary, State and local health departments are charged with assessing the health status of communities. We use both subjective and objective information to assess health status. The information is used to plan effective interventions to improve health status, reduce disparities, and make progress toward health equity. This is the end of part 1. The next video in the series is about assessing health status and the meaning of risk.